Reporters Blog today, we're going to take a health tour of Shai Osudoku here in Accra. And our Sweet 16 will be joining us in studio after this break. Please stay. Before we start the discussion, let's watch this video.
Many people in Ghana have had bad experience at the hand of a nurse, midwife, or other health workers. Many of these cases changed the lives of the victims for the better or worse. On many occasions, the repercussions are dire. Some victims never live to tell their story. In sub-Saharan Africa and Ghana in particular, women still die in childbirth. This is unacceptable. To reverse this trend and promote safe pregnancy and labor, the Ministry of Health, Ghana Health Service and other stakeholders have introduced several measures. But how many have worked? About 130 million babies are born annually. Of this number, over 3 million die within the first 4 weeks of life, and another 4 million are stillborn, and these babies are not counted, and their families grieve in silence. We can bring joy to families if we promote maternal, infant, and child survival with excellence. Let us all promise to save lives. These are the words of the current Greater Accra Regional Director of Health, Dr. Linda Vanutu, who has done so many things to make sure that this dream is realized.
We realize that over the years, a lot of effort has been put into saving mothers and babies. And I'm sure you are aware of the Millennium Development Goals that specifically looked at reducing maternal deaths and also reducing child deaths. And because of that, countries all over the world, communities, facilities put in so much into reducing these deaths, which unfortunately occur. So we realize that there has been some reduction, and Ghana is one of the countries that also committed to ensuring that maternal mortality is reduced and child mortality is also reduced. So some work has been done.
So I promised myself to find out more. My journey to know more started with an encounter with a young midwife in charge of one of the CHIPS compounds in the Shai Osudoku district. Comfort Abire told me she squats with women in labor because they refuse to go the conventional way.
At my place and here like this, most of them come in labor preferring the squatting position. So when they go in labor, you also go in labor. We squat with them for them to put their hands on our knees. And then they hold you, they use you as a firm support, and then they can push.
Then I learn about how peculiar the Shai Osudoku district is. It is part of 16 metropolis, municipalities and districts that make the Greater Accra region. It is the largest district in the region located on the southeastern part of Ghana. It has a land size of 1,522 square kilometers.
Our district is huge.
I'm looking at your map.
Yes, it's huge. 60,971 population. This population is a population of a sub-district of another smaller district. So they have to walk distances and you don't have money to give them. You don't have motorbikes to give them. But I'm really proud of the teams.
Health needs of the people here are like any other across the country. Fortunately, there is a twist to the situation at Shai Osudoku district.
At the same time, family planning now time as say there will be until I have.
I learned for the first time that nurses move from house to house to attend to the health needs of residents. Key among the targets of the health directorate here is to ensure that no woman loses her life giving birth. Dr. Kennedy Brightson is the medical superintendent of the Shai Osudoku District Hospital.
So it's a man, okay. So the post-operative cases, they are here. But like I'll say, we don't reject patients. So we have patients on the floor. We have patients on the floor. We do not say that we don't have beds. So when you look at it, it's a student's mattress, and we got 10 from NADMO in Dodua, National Disaster Management Organization. Mr. Ajakli was kind enough to us. We called him. He gave us this. These are post-op cases. We just finished operating them. You know, this was the first case, right? Okay. So this is on the floor. We would manage. When I wake up from home and I'm going to the hospital, there is one prayer I offer. And it's like people ask me, so do you pray? I say, I don't pray a lot. I just have a short prayer. So one day I was asked, what prayer is that? I said, God, use me again today to save as many as you want to save.
What a powerful prayer. I like the prayer. It's so short.
Finish. These days, a lot of pastors have been deceiving them. And it becomes a big problem. So they go for prayers, they don't come for clinicals. But when the prayers get to the peak and what they are expecting does not happen, and death begins to stare at them, then they are rushed to the hospital. We save them. We save them. But we suffer to save them.
Like Dr. Brightson, the Greater Accra Regional Director of Health has her own promise. In 2008, Dr. Linda Amaka Ivanotu developed the PROMISE model. The PROMISE stands for Promote Maternal and Infant Survival Excellence. It was developed out of a desire to identify the reasons for the high number of stillbirths and maternal deaths recorded in the western region of Ghana, where she was the then Regional Director of Health.
PROMISE basically is ensuring that we offer care to pregnant women and their babies, and also involve the families and the community as best as we can. And one of the things that we did was to have what we call the PROMISE drivers. You know, we've always talked about the 3 delays that contribute to maternal death, that contribute to child death. The delay in the person seeking care, the delay in getting to the health facility, and the delay in giving the care when they have gotten to the health facility. But I realized that there are other things that come in, and it starts even before somebody becomes pregnant. So we're talking about nutrition, we're talking about family planning, we're talking about adolescent health. Because if you want to have a baby, then you must be prepared for it. Yes. If you don't want to have a baby, you should prevent it. So we look at that. And then we also need to link public health and clinical care together. because that is the whole health. We cannot do one and leave the other. So we need to do it together. We need to be able to refer. And if we are referring, the place where we are referring to must know that we are referring somebody, and the one we are referring also have to understand why they are going to the next level. Sometimes people are afraid that it means my condition is going to kill me. And then the most important thing, we need to involve the community. So the promise drivers that I am talking about are a set of 12 things that we can do. Each driver has more than one thing in it, and there are several activities. But inside, in the middle, is the community.
Today, she is implementing the promise in the Greater Accra region, and it is catching on like wildfire. One of the modules of the promise is the pregnancy school.
What we do is that we hold meetings with the pregnant women and the spouses or anybody else who matters in that pregnancy. Okay. So it could be your mother.
Stakeholders of the pregnancy.
Yes. Because these pregnant women, as somebody said, hear a lot of voices. The voice from the Ghana Health Service, the voice from another person, the voice from another provider, the voice from even the media where people are talking about issues. And this pregnant woman can be confused. And she may not have an opportunity to even ask anybody. So we organize these pregnancy schools outside the antenatal. There you can bring your husband, you can bring somebody else. And we present something, you ask questions. Okay. We also do it we have 3 trimesters because pregnancy is 9 months. Yes. So the first 3 months, the second 3 months, the third 3 months. And what we're trying to do is to bring in innovations as we go along. Okay. So for now, we have the first trimester, the second trimester, and the third one, so that we target our education. So if you come and you are in the third trimester, you are getting, yes.
What is specifically
for you? That? Yes. Because you are getting close to delivery. So you must be prepared. You should know what to tell you that I'm in labor. Okay. You should know what you should do. You should know how to handle the baby. And if you are in the first 3 months of your pregnancy, you may be vomiting. And that will be your challenge. How do I handle
life challenges?
Yes.
It's good to put them in one class and then you address them.
And then we address them. So if you have your husband come in, he can also ask questions. We also use the pregnancy school to do some couple counseling. If you have something that both of you don't understand, that's an opportunity for you. It is important to do this because at the regular antenatal, we have so many people, the nurses are overwhelmed. And there's no space. Yes. Right. And since the people come early, we want them to finish and go home so that they can go and continue with their work. So the pregnancy school is an opportunity for you to learn about pregnancy, for you to ask questions. And if you've heard anything, you also, and then it also affords the midwives to know their clients better. Okay. And if there's any client that has a particular need, then they can address that particular need. If it is held within a hospital, then we use the opportunity to take them round the hospital. Some people are afraid of the labor ward or the theater and the rest. Yes, so we talk about it, and you can even peep into the theater. You will not go in there, but you stand out, you look and see that it is nothing like what you have heard. Okay. And the labor ward too. The men have an opportunity to go inside the labor ward, and they are told how delivery is conducted and all that. Yes, if we have any videos, we can also show them. And we teach them about the care of the newborn. So the pregnancy school is used for many things.
Welcome back. And now she joins me in studio.
Thank you for having me.
I believe you already know her. I don't have to mention her name again. Honorable Martha Krentz-Solakwa.
I get to be honorable in your seat. Thank you. Grateful.
Shai Osidoku.
Yes.
This is virtually like the 3rd time from the Belhazer water to
the sand winning in the Volta Lake and shell winning.
The shell winning. No, that's one.
Yes.
Okay. So what is it about Shai Osidoku?
So this time around, like you said in your intro, is a health tour. And this tour is supposed to be about what they are doing differently in that district to help mothers save their lives and save their babies as well. Okay. So it's more of a concerted effort towards reducing or eliminating maternal and infant mortality completely. So I went there, I spent some days, and the district is so huge. We had to tour the whole district and find out how they are working in the hinterlands. Though it is in Accra, it's rural Accra. So you have people who are deprived, you have people living sparsely, they're sparsely populated. So you see one hut here, the next hut you see will be like a very long distance from here. So these healthcare professionals, those who operate the CHIPS compound, the CHIPS zones, those from the clinic, go from house to house.
From the story, you realize that these health officials are very dedicated to their works.
They are too dedicated.
At the end of the day, you move from the office, travel all the way to someone's house, then from there to another.
And like they said, most of them don't have means of transport. You know, the roads there are not very good. So if you can afford, you have a motorbike. If you can't afford, you walk. And most of these healthcare staff don't have any from the Ghana Health Service. So at best, they walk long distances to go and administer.
Extra something?
No, they get the same salary those in the urban center.
But why are they not demonstrating?
Yeah, they don't. In fact, when you see all the others going on demonstration, they are not with them. They are still at post, because I remember one of them told me they feel like they are part of the people.
Okay.
And so they give them their all. They don't see the need to hold back anything. So at a point, they said they even share their salary with them, because for instance, if they don't want the pregnant women to deliver with traditional birth attendants, so they encourage the TBAs to bring the pregnant women to them, to the CHIPS compound, CHIPS zones, or to the clinics to deliver. When they bring them, they appreciate them. So they buy soap, they give them something, they tip them for bringing the pregnant woman there to come and deliver, because they are encouraging the pregnant women now to...
From their own salaries?
Yeah, they do that. Strange things happen. Then, for instance, if you want to take a decision on family planning, they come home at the comfort of your home. So what do you want to do? This one,
Let
that
me ask
one,
this couldn't it be because she took the camera there, that is why they had to reveal everything like this? This is what we do. And then maybe that day, because there was a camera around, they had to go with you to visit some of these pregnant women?
If it was staged, you feel it. This one, for instance, we went to a Fulani community where you have a woman who had just delivered. The baby was less than a week old. They were wondering whether the mother came to the health facility to deliver. They asked her, she said the woman was deaf and dumb. So they couldn't communicate with her. Now, here is the thing that tells me they do it all the time. In that community, they have a woman who is, should I call her, an interpreter for the health team, because they are Fulani herdsmen and their wives and their children. They don't understand the native Dangbe or Chi or Ga. So what they do is they have this woman in the community who is also a Fulani woman who understands basic Chi. So when they go there, she gives them information. There's a new person in town. Somebody has delivered here. And the woman will be taking them from house to house. So that day we visited too, apart from the woman who had delivered and they were not sure whether she delivered at the hospital, we went to another person who was 9 weeks pregnant. And they took her records and she was translating what the healthcare officials were saying, that she's supposed to go to the hospital the next date and when she goes, she should ask for this medicine, that medicine. That's what they're supposed to give her. So it tells me, it's not like they saw me around and they are doing this. Immediately they get to the community, this woman welcomes them. She knows them. They've been going
But
there.
it's staged a little.
No, it is not. Because so where the community health nurse wanted to rebuke someone, she did it. She did it, and I saw it. Especially when she realized that they had not dressed the cord of the baby well. They said they were using some oil, and she asked them, which oil? And you can see they couldn't explain what they had done to the cord, and so there was some, I learned it was contaminated, kind of, so something coming out of it, it wasn't good at all. She needed to clean it all over again and assume that the baby had not gotten the BCG, that's the injection you get at birth. So they had to do it for the baby and assume that, okay, they didn't take it for the first time and give the baby all the other things she's supposed to get. It's not staged. That's them. On our way, the rain poured, we suffered. We went to sit under a tree waiting for them to come. The women came all right. Some of them had issues. Some of them came late. It was normal. Nobody told them we were coming. And so when our car broke down, we had to push the car. It wasn't staged. It was all part of what they go through. They wanted me to experience what they go through. And let me tell you one. When we went for the Fulani community, in fact, we got a taxi to take us there because it's far from town. Immediately we got there, the accountant at the district health directorate called one of the nurses and said, tell the taxi driver to leave here and come. He can't wait for you. If he waits for you, we'll pay more. So I wasn't supposed to hear that conversation.
But you heard it.
The taxi left. Then they told me, Madam, it's because you are here. That is why today they gave us taxi to come. If you were not here, we would not have even taxi to come. We'll walk here and walk back.
That was a privilege for
them. And they do that with joy. So the district health director was telling me she was hoping that she could get some motorbikes, something for them, you know, to facilitate their movement so that they will not have to struggle. Because they are doing what nurses in the urban centers will not do. And yet they are getting nothing for it.
I like the dedication. I like, because if I have to compare them, because they virtually have nothing.
They don't have
anything.
And they don't have a life.
They're giving their all to just eradicate maternal mortality.
I don't know if I've told you before, but there was a midwife a young midwife, her name is Comfort Abire. She got me thinking about going to do this documentary.
Okay.
Because the first time I visited the area, I spoke to her, it was on a different mission. And she told me, oh, in my part, when they come, they don't want to lie down and deliver their babies. They want to squat and push the babies out. They claim that is more comfortable. And yes, that is comfortable. That is much better. It's quicker. So that's what they want to do. And this lady is as small as both of us. But she has to squat. And then these women who are bigger than she is will hold her. And they'll be pushing. So like she puts it, when they go into labor, I also go into labor. Together they push. Yeah. So that was what got me thinking that there's more in this community than meets the eye. So I'd like to go back, and that's why I went.
Okay, before we go into the labor issue, let's watch the behind the scenes. We'll be right back.
Yeah. That one is some mark we are in. I want to need it. When I'm person, me now. Me too, bra, dada. Ozi on yedda. Uncle, I'll do with you there. Okay.
It was work and what I would say. Three.
Let me see her girl.
It's a year back of my car. It's of sister, you better charge the brain or because it. And the Emma can look, but I'm trying to say, can't look at a year there now.
Oh, interesting. To the labor.
Yeah.
You went to the labor ward. Because you could hear one woman scream, and it said, if you have to push, open your mouth, breathe, taking a deep breath, and then push again. You have delivered. You have 3 kids. Being in that room with them, what comes to mind? Like, does it remind you of your experience? You never went through that.
I didn't get the opportunity they had in the pregnancy school. You know, they have a model called the pregnancy school model. So whilst you're pregnant, you go to school. And the school is supposed to
throughout
teach
the 9 months?
Yes. They have 3 classes. So you have the first trimester class, you have the second trimester, then you have the last trimester. So what happens is if you are in the first trimester, they teach you things that you need to know whilst you are pregnant for the first 3 months. So you'll be experiencing morning sickness, you have this, you have that. It's normal. You get over it. this is what you can eat, this is what you can do to make you feel better. You get to the second one, they take you to a different class. They teach you that one. You get to the third one, they start teaching you the options at birth, at the time of delivery, so that if you can't do the push, you can go for CS, cesarean section.
You're listening to all that.
And I know it sounds...
Were you part of the 3 classes? Like?
Yes, yes. I did the last class, that's the last trimester in the district hospital.
Okay.
Then I did the first 2 classes in one of the sub-districts. So I joined them also. So they were being taught what to take to the hospital so they don't go and borrow, why they should take those things. So it's like you get that understanding before you go to the hospital. Okay. Unlike other parts where you don't get that education, and so all you know is that I'm pregnant, I've gone to deliver. There are people who go to hospital without anything. They don't have anything at all. They get there
and they don't even know about it.
They don't know, but here they teach you. So the one you saw is like, whilst you're in the class, they tell you that when labor starts, it's painful, yes, but the only way you can get through it is to push. So what you do is when the labor gets intense, you breathe in, then you push through it. If you are taught that way, you know that you are pushing through your abdomen and not through like your upper body. The strength must come down so that you can push out. If you don't do that, then you are just making noise. You are just complicating your matter.
You witness someone give birth.
Yeah, but it's normal. I've seen that one too many times, so it's very normal. It's okay. It's very normal. It's
okay,
fine.
you already have the experience, so when it comes to describing it, it's still something normal to you. I think I want to see that someday.
What I wanted to see was a CS section, but when I got there, Dr. Bryson had actually just finished one and had staged, and he was doing like 6 for that day. So he had done
6.
Yes, he had done 3 and 3 more to go.
What if maybe in the course of working on one, the other 3 or the other 5 are in labor?
What happens is you have 2 kinds of CS. You have the planned one and then the emergency one. The planned one is when in the course of your pregnancy, it comes up that your baby is too big for you to push.
Okay.
Or you have issues, your own issues like blood pressure, high blood pressure. So the moment you start pushing, you're likely to lose your life or the baby's life. Okay. So that is a planned one. They advise you that because of the issues you have, let's go for CS. So they don't wait for you to go into labor. They book you for CS. Then they have the emergency one that, for instance, you are fine, everything is okay. You just fell down at home and you start feeling pain, you're bleeding. You are not in labor, but they need to save you and save the baby. So that is an emergency CS. So what he was doing that day were all planned. Those people were scheduled. But whilst I was there, there was one woman who was brought in, and actually there was no bed, so she was lying on the floor because she came in bleeding. It wasn't time. They managed to stop the bleeding, so they didn't have to do the CS. She just left her lying there. But he told me a story. Dr. Brighton told me a story about a woman who was brought in by a taxi driver, and the taxi driver left her at the entrance because the woman was unconscious, and the taxi driver thought she was dead. He has not done anything. He doesn't want police case. So he left the woman at the entrance and moved away. So they carried the woman, brought the woman in. At that time, he was doing 1 CS, and they brought the woman. He needed to do it. So what he did was to put this one shortly on hold, set everything up for this one, and teach his assistant
how to do it.
Whilst he was doing this, he was giving instruction what to do and what not to do, just to save the woman's life, and they were able to do that.
What has been the most interesting thing doing this particular story?
That when women have the knowledge, they can change so much. Because you can imagine an illiterate sitting there and telling you, my baby, and giving you cake counts, giving you scientific reasons for what is happening to her. So my baby's cake count today is 15. It's lower than the 30 or 20 I often get. You don't understand the cake count.
Do they kick every day?
Yeah, they do.
Okay.
They do. So some babies are very, very active.
Okay.
Like when I'm pregnant, you see they are so active, they move around. I think you have even observed that before.
I thought
there
maybe
are others
there's
who
a
are
particular
not,
time for it. I didn't
there
know.
are others who are not very active, so you must know yourself that if your baby kicks like average of 15 times a day, the day that baby kicks 5 times, it means there is a problem. There's something wrong with the baby. And you know, I learned about some traditional practices, cultural practices, like I learned others go to their aunties to tend the baby to sit well before they deliver. In the course of doing that, they rather, the cord will wrap around the baby's neck, and that can kill the baby, or the placenta will just burst, and that will be the end of that baby and the mother.
This is not just a story, but it's an education. Yes, I've really learned a lot today. I think I need to see you for more. Anyway, thank you for your
behind
time.
the scenes.
Thank you so much for your time.
Thank you.
And that was Martha Crenshaw Aqua with all of that. It's not just a story. I believe you have been educated. I have been educated as well. Thank you so much for sitting through to watch us, and have a lovely week.